Hello everyone and welcome back. So today we'll be studying about consent. This is very important topic for general practice as well as to prevent yourself from various negligence litigations and all. So first of all, what is the definition of consent? Consent क्या है? What is the definition of consent? It is basically the in simplest word. It is the voluntary agreement. It is the voluntary agreement or compliance or permission, basically voluntary agreement or compliance or permission, or as per the Indian Contract Act, as per the Indian Contract Act. This was the act in 1872. There are two sections. Section 13, as per the section 13 of Indian Contract Act, that says that if two or more person are set to give consent when they agree upon same thing, when they agree upon same thing in same sense. So if two or more persons are set to give consent when they agree upon same thing in same sense as per the section 13 of Indian Contract Act, this is consent. So दो से ज्यादा आदमी यदि एग्री होते हैं किसी सेम थिंग पे सेम सेंस में, दो और दो से ज्यादा, तो दिस इज नोन एज consent. Now one very important point is section 14 that says that this consent is said to be free. Free means without any influence, without any undue influence, or without any fraud, or without any mistake or misrepresentation. So this consent should be free. Free means it should be without any undue influence, without any fraud, without any mistake or without any misrepresentation. So basically consent hai kya? Consent is basically voluntary agreement, compliance or permission, or as per the Indian Contract Act 1872, section 13 of 1872 Indian Contract Act says that यदि दो और दो से ज्यादा लोग एग्री करते हैं for the same thing in same sense is known as consent. And as per the section 14, the consent should be free. It means it should be without any undue influence, without fraud, or without any mistake or misrepresentation. This is the consent in the simplest word. Now consent should be clear, and as we have discussed that it should be free. So the consent should be clear without any ambiguity in the simplest word, and it should be direct. It means it should be directly conveyed to the person who is taking consent, to the person who is giving consent. So it should be direct, and the consent should be free without any undue influence. It should be intelligent consent. Intelligent means the patient or the person who is giving consent should understand the implications of giving consent, or the whatever the treatment the person is receiving, that person should understand the various implications related to that. So it should be clear consent, direct consent, free and intelligent consent. So these are the few features of consent. Now at times there may be conflict in giving consent. Suppose two persons related to a victim or some person whose consent you are required for examining that person. Suppose a 10-year-old girl is there and brought to you for examination purpose, and because there is an allegation of sexual abuse. So with the history of sexual abuse, and you have to examine this 10-year-old girl. Now, how to proceed? Because girl was the girl basically not able able to give consent, because the age is less than 12 years. So, girl cannot give consent for general physical examinations. So, we will go to parents. Now, there is a situation when the mother of the girl has given the consent, but father refused. Father refused. So, you should convey the same thing to the IO, the investigating officer, and the IO can go to competent court for order regarding examination through police. In such a situation, you should convey the same to the investigating officer, and then that officer can forward that to the competent court, and then court issue some order related to examination of that victim. So, this is very much important. At times it is very significant. What is loco parentis? What is loco parentis? So, what happens if in case of emergency, if parents are not available? Suppose in case of emergency. So, what is the literal meaning of loco parentis? Means in place of parents, in place of parents, loco parentis. So, if the in case of emergencies, when the parents are not available, so the person in charge of the child, the person in charge, any person who is in charge of the child, like any school teacher, hostel warden or whatever, he is basically can give consent for the examinations as well as for the treatment of that child. So, at the place of parents, in cases of emergencies, the person in charge can give consent. So, this is the concept of loco parentis. Now, the kind of consent, what are the different kinds of consent? So, different kinds. First is, if the information are not completely informed to the patient or the person, then this is uninformed consent, uninformed. But if the complete information are given to the person who is giving consent, then this is informed consent. Now, other classification is as per the patient communicates to the doctor, the way by the patient communicating to the doctor in different manners, like implied consent. When basically implied consent is like when patient's action imply consent. So, the action of patient implies the consent, like in cases of routine OPD or routine visit to the OPD, the patient is basically like in case of routine practices, the consent is implied only for that too only for general physical examinations. At times you may need consent. Suppose a male doctor is going to examine a female patient, then this is a sensitive case and you must go for the consent, the written consent. So, implied consent can be seen when the person is basically while routine practicing and patient's action is basically imply that consent, like the telephonic conversation, SMS or email conversation, a doctor or asking for advice or getting OPD card made and taking the consult from the doctor, or just in the simplest way like holding out arm for the administration of injection. So, this kind of acts are basically under the implied consents. Now, something is known as expressed consent. Express consent, it means when the patient specifically consent for examinations. So, certain specific consent for the purpose of examination. So, specific consent for the purpose of examinations is known as express consent, and it should be it may be verbal consent, verbal like oral consent, or it may be written consent. It may be written consent or it may be verbal consent. Now, basically this consent is required for the various procedures beyond routine physical examinations, like routine physical examinations. Beyond that, like the biopsies or blood transfusion or the lumbar puncture or various other procedures like surgeries and all. So, this kind of express consent is required. So, basically as per the patient is giving to the doctor, the consent is of two types. First is implied and second is expressed consent. Now, something is known as blanket consent. So, what is blanket consent? Blanket consent. So, it is where the doctor takes consent from the patient for any possibility or every possibility, every possible diagnostic or treatment. So, any possible diagnostic or treatment procedure that might have to be undertaken in future. So, this is the blanket consent for all the for any or every possible diagnostic or treatment procedures available for during the process of treatment, that such procedures or such diagnostic procedures or the treatment facilities may be required while undertaking the treatment in future. So, this is the blanket consent. Basically, under such circumstances, when the doctor himself is not sure for kind of treatment available. So, when the doctor is not sure for kind of treatment available and patient cannot explain the risk involved. So, under such circumstances, this kind of consent is required, and in the simplest word, this consent can be taken like I hereby authorize the hospital staff to perform, like the patient is giving the blanket consent, like I hereby authorize the staff or the doctor to perform any surgical or on procedure, the diagnostic procedure. So, this is the consent, the blanket consent. This concept is basically invalid. So, this is the consent which is invalid in the eyes of law. So, this is invalid consent. Such blanket consents are totally invalid. So, just to avoid such practice, and you can save yourself from various negligence litigations. Now, what is proxy consent? This is also important. What is proxy consent? Proxy consent means like surrogate consent is also known as proxy consent. It is basically the consent given by relatives or next to kin or the friend of the patient. So, this is known as proxy consent. Under like if the age of child is less than 12 years or the unsoundness, or simply in cases of intoxications or unconsciousness, the person is unconscious, then the proxy consent is basically can be given by the relatives or next to kins or any friend, etc. So, this is known as proxy consent. Now, another important thing is the components. What are the components of consent? So, basically as we have discussed, the consent should be actual consent. It should be actual consent, and there should be disclosure. It should be actual, means full, free and voluntary consent. Complete disclosure should be there for the patient by the treating facilities or treating doctor. Now, it should be comprehensive. The should be comprehensive so that patient can understand the consequences and the nature of the treatment or the diagnostic facilities or the procedures being done. Now, there should be absence of outside control. There should not be any outside control. So there should not be any outside control. It should become comprehensive. There is complete disclosure, and it should be actual consent. Now, if the person or the patient is refusing, so there is a situation when the patient is refusing to give consent. So this is the important to note, that is known as informed refusal. So what is informed refusal? It means that the doctor must inform the patient about the risk involved of refusing any particular treatment modality or any treatment facility or any medication or medical intervention, or doctor must inform the consequences of refusing the operation, refusing the treatment, and refusing the various medications and all. So and it should be noted down in a writing form, in writing with sign. It should be signed and witnessed consent. Detailed, written, signed and witnessed informed refusal should be taken, and it is basically legally valid. It is legally valid only if it is written and signed and witnessed consent, then it is legally valid, because it is just to save the various litigations. Such informed refusal should be taken, and everything should be explained to the patient in their own language. Various consequences and the complications related to such refusal should be noted down in detailed and writing, and proper signs, as well as the proper sign of the witness as well as the doctor. So this is the brief about the consent. So please do take care of taking various type of consents while doing day-to-day practice, and while before examining, before giving any kind of the treatment or any kind of the medication or any facility or any diagnostic or any kind of the minor or major surgical procedures. So thank you so much, and keep on watching. Stay tuned. Thank you.